Home visiting is important in South Carolina because we are a very family-oriented state, and we know that when families are strong, children do better. But we also know that we have issues across our state that detract from keeping our families strong. There's a lot of poverty, there's a lot of limited education. And we know that when you start out strong as a baby and you have a good nurturing environment for those early years, your likelihood of having successful outcomes later is all the better.
When we talk about home visitation, this is an idea whose time not only has come, but it's overdue. Home visitation works in South Carolina.
The nice thing about home visiting is it crosses a lot of different disciplines. It's not just child abuse prevention, it's maternal health, it's early childhood development, it's infant health. It crosses all those disciplines.
We have a lot of needs among the children. What better place to get them than when they're young, in the homes, in the environments, because the children themselves can't deal with the issues. We've got to get to the parents, we've got to get to the people that are raising these children, we've got to help them to make these children stronger so the state of South Carolina can be stronger.
I'm a physician, and so most of the time when I'm seeing patients, it's in my office and one-on-one. And really there's only so much that you can do in an office to really get at the root of a lot of the causes behind the stress that people have in their life. So I think it's wonderful to be able to go out into the community and meet people really where they are. I think home visitation just allows you to deliver such a more comprehensive range of services and things people really need.
They may not otherwise, be able to get to medical offices or other resources. So being able to visit in the home is tremendous, particularly I think in rural parts of the state where transportation is an issue and there are other barriers to families participating in programs like Nurse Family Partnership. So it's vital that we continue home visitation services. We've just got to expand the services that are available.
You can give them tools that are not only going to affect that child, but like with our families, we serve 2 to 5-year-olds, but there's siblings in that family. So we can work with that 3-year-old and mom gets those skills so that when she has that next child, she can apply those skills and we wouldn't have the youngest sibling in our program. So it's critical.
We think home visiting is great in South Carolina. We think we have a wonderful infrastructure, particularly with the Children's Trust leadership, with the investment from McVie, private philanthropy, and others. We think there's a great infrastructure in place to really continue to grow and expand home visiting, and really to make sure that home visiting, family visiting across the state is in place, is working, is available, and there's access particularly for low-income parents.
Not only from an economic return on the investment in the traditional sense, but it's really a social return on investment. We are looking at the dollars that can be saved by helping these young mothers complete their degrees, go back into the workforce, help these children have that good start to an early education. And so, we look at it from the dollars and cents standpoint, but we also know that it has so many more added benefits, both in terms of the communities in which they live, and then how those individuals then in turn go, as they grow and mature, give back to their communities.
One of the things that appeals to me the most about home visitation in South Carolina is that it's done with evidence-based home visitation programs that have research that support all of the positive outcomes that you can expect. And so if we're implementing the models with fidelity here in South Carolina, that we have every expectation we should see the benefits here that they've seen in the randomized controlled trials. So it's worth the money when we can prove, that the intervention we're using we know works.
I'm excited to see how our state is really looking at the range of home visiting models and being able to find the right program for that particular mom in her situation such that she is given the best chance to receive those services, and that not only helps her but then that young child.
There's a lot of need to actually define what those systems are, what they look like, and how they can actually be measured. And a lot of the work that we're doing on behalf of the Children's Trust is trying to get at that, where we're really trying to look at not only the evidence-based programs that are being implemented in the counties, but trying to learn something about the counties and the organizations and all the context in which the programs are implemented to see if there are factors about those systems that we can learn about to help us improve them as we move forward.
We're certainly building momentum. I don't know that we have finished the job by any means, but I do think it's gaining ground.
We are trying to unify a voice, and we are, bringing together partners that are strong voices, whether it be from the local level or at the state agency, representatives, legislators, and really it takes, it truly does take a village, and we got to get past working in silos and really just looking at our specific targets and looking at the broader picture.
The programs across models are working well, but we need to be able to serve many more families across South Carolina.
I think we're going to have a good public-private partnership when it comes to expanding beyond the grants that Children's Trust offers to the different organizations. We're going to have a lot more people step up to the plate.
I think Children's Trust deserves a pat on the back for more than just this. They've done a great job for the state of South Carolina, and we appreciate being partners with them.